How does balance indicate good health?
Today we ask, what does balance have to do with your well-being? How do we know if we have balance issues and what should we do about it? Today we talk to Aaron Cook. He is a physical therapist and owner of Physical Therapy and Balance Centers to find out more.
As a health coach and a wellness coach, we ask the questions so you get the answers. So let's get started as we ask.
Wait, what?
Hi, Leah.
Hi, Kamna. I hope I said, did I pronounce it right? It is physical.
It is physical. You know, it's FYZ.
Okay.
Everybody always makes the let's get physical Olivia Newton-John reference as like a little fun catchphrase into it.
I'm going to get that stuck in my head now. Yeah.
I know.
I'm excited to talk to you. Okay. So do you want me to just read your intro?
Yeah.
All right, let's do it. Aaron Cook is a physical therapist and owner of Physical Therapy and Balance Centers in Mentor, Ohio, specializing in balance, dizziness, and fall prevention. So many questions. He holds advanced certifications in balance therapy, levels 1 through 3. Aaron earned his doctorate of physical therapy from Ohio University. He has helped hundreds of patients regain their balance and confidence after a wide variety of conditions, including strokes, vestibular disorders, and neurological conditions. A lifelong Ohioan with a quick stop in Las Vegas, which we could go down that rabbit hole because that's his favorite place. Aaron loves spending time with his wife, Kelly, and their 2 kids, Scarlett and Grayson. Outside of the clinic, you'll find him hiking, playing guitar, and cheering on Ohio State football. That's a bio.
Welcome.
Yay, welcome.
Thank you for having me. Good to be here.
Excited. Full disclosure, I found Aaron. Do you want to know how I found him? Going to frozen yogurt with my daughter.
Wait, I need to hear the story. What do you mean?
So my daughter and I were in Mentor. My mom lives right up the street from you, where your place is. And we were like, I've been promising her we would get frozen yogurt at this place down the street. And I'm like, all right, let's go. Finally, the one time we did. And like, we get out of the car and I go, I'm going in there. I go, we need to talk to a balance person so bad because we have so many members and us ourselves have been talking about balance. So I went in there. She's 14, so she was thoroughly embarrassed with me the way I went in, and I was like, we need to talk to you on our podcast. But full disclosure, I got like a really full cup of frozen yogurt with all the toppings. I mean, it was like candy toppings, no fruit. It was all the sweet stuff. So
that's the fun stuff.
It's the good stuff. Anyway.
It is so great. Like, I remember you came into my office, you're like, hey, can we interview somebody about balance? Like, I'm sitting right at the front. Yes, let's do it. Let's make it happen. So here we are.
I was so excited. I was like, oh my God, this is perfect. Because I want to say it was just that week we had somebody that has been working on balance from home and what exercises to do. So it was just like a perfect timing, I think. So, all right, come to rein me in. Where are we starting?
So I would like to know where you started and how you specifically got into balance. Like, tell me a little bit about that journey.
So for me, my passion as a physical therapist was working in what's called an acute rehab setting. So this would be somebody has a stroke, half their body's paralyzed, they're in the hospital, and then at a certain point we go, oh, half my body's paralyzed. I need to walk. I need to be able to go to the bathroom. Who helps with this? So that's where the physical therapist in an acute rehab setting come in. So I was really drawn towards that aspect of things. Somebody falls, somebody breaks their hips, somebody has really bad Parkinson's, all kinds of different conditions, and they end up in these rehab hospitals. And it's my job to help get them back up on their feet. And 99% of them have an issue with balance. I was really passionate about kind of getting people home, helping them get their independence back. You would work with so many people that are, they're, tough guys, they're lumberjack types, and then, one broken hip and all of a sudden they're in a wheelchair. So I had a ton of satisfaction just working on that aspect of things, helping people get their lives back. And I really developed a love for that, those kind of conditions. Then during COVID, my position, I was working in a hospital. My position got downsized because of the pandemic. So I wanted to open my own clinic. That was one of my big goals. So I partnered with Physical Therapy and Balance Center. They're like a national franchise. There's like 600 locations. So I opened my, Yep. So they're kind of the world or the country's experts on balance therapy. I knew them by reputation in Las Vegas. I was like, I want to go work for one of these. I'm moving back to Ohio during the pandemic. I want to go find one of these physical so I can work at one. And it was like, oh, there's none in there. Let me just go ahead and open one. There's a big underserved balance population right now, especially as the baby boomers are getting older. A lot of them are struggling with walking. They go to their doctor, they're like, I had a fall, and their doctor basically says, well, I don't know, use a walker for the rest of your life. Get out of my office. I don't have time for you. That's kind of what modern medicine was doing for people with balance issues. They say, well, you're falling, use a walker, use a cane. I don't know, get out of my office. That's like, not to be blunt, but that's what a lot of people were experiencing. And I would work with these people. I'm like, you have so much potential. You just have X, Y, and Z problem. If you just did did these 3 exercises and you did it every day for a couple of months, we could get you off that walker. We could get you off that cane. We could get your life back.
Yeah.
We could get you out of the house. So it's just something that I've been really, really passionate.
On a side note,
Go ahead.
I think physical therapists do like magic work. The number of people who, at least in our groups, who are helped by physical therapy, who find so much relief, I think it's incredible. It's a very, what do you call, curated field in terms of what they
Yes.
do.
Yes, we're slowly but surely building that public awareness and that public trust. And one of the big things I'm an advocate of is something called direct access physical therapy. So most people think I can't go to physical therapy without a doctor. That hasn't been the
Oh,
case for like 10 years, at least in the state of Ohio. And now in all 50 states, you don't need a doctor's order for any reason to see a physical therapist. So if
And
anybody
your
out
insurance
there
will
is
cover it?
most of the time, yes. There's a few stragglers out there, but in my experience, I used to tell people, I said, most of the time, yeah, but your insurance might not cover it. But honestly, nowadays, the insurance are wise to it. The insurance company, it's their job to make money. And they figured out when somebody's back hurts or if they were falling, it's a lot cheaper to go to physical therapy and get stronger and make your back not hurt as much. It's much cheaper to do that than to pay for back surgery or to pay for a hospitalization when somebody falls and breaks a hip. So surprisingly, the insurance companies were actually pushing this more so than the patients or the doctors because they were viewing it as a cost saving metric and the patients were getting better faster. So it's one of those few like win-wins in healthcare that I love.
that's incredible.
Yeah, that's a good.
If insurance covers it, I'm all for it.
Yes. Now these days you get a lot of high deductible insurance plans. You end up paying full price for PT, which is a challenge for a lot of people. That's like the first question everybody asks, like, what is this going to cost me? And it's so hard because you'll have one patient. It's like, well, if it's Medicare supplement or Medicaid, it's probably going to be completely free. But if you have private insurance, if you have Blue Cross, it's going to be like $100 a visit. And if you have any other plan, it's somewhere in between. So it can be a bit of a barrier to people, but ask your insurance company, find out what kind of plan you have because a lot of them, I mean, a lot of plans, it's $20 copay for an hour session, one-on-one is pretty good.
It makes sense.
Yeah. Okay. So you said some things that you said. First of all, I didn't know acute rehab means you're staying in longer.
Yes.
Okay. So that's not like where you break your foot and you get to go home with crutches. That's like you broke it and you need to stay there and get rehab for that, right?
Yes. Usually you'll end up going to like either a separate part of the hospital or a separate company. So you'll see a lot of rehabs. Some of them are skilled nursing facilities. Some of them are a true acute rehab. The main difference is how much time you spend with a therapist. A lot of places have the word rehab in the name, but there you only have to spend like 30 minutes with the PT. A true acute rehab, what I was passionate about, you have to spend 3 hours a day with your therapist. So
Oh,
it's like
wow.
minimum. Insurance will kick you out if you're not doing an hour and a half of PT and an hour and a half of OT a day.
Oh, wow.
Those places are they're not very popular in this area for whatever reason. I find a lot of places are now nursing homes, but there's still a few true acute rehabs out there.
That's good to know. I never knew that there was really a difference in that. Okay. All right. My second question is you said that you were seeing people that had balance problems. Are they having balance problems before they fall or?
Great question. Great question. Well, this is American healthcare system 101. We don't do anything preventative. We wait till it becomes a big problem so we can spend a lot of money on it. So
Oh, true.
yes, all of these people have likely had signs and symptoms of being a fall risk. Most of them have told me, hey, I fell 2, 3, 4 times before I broke a hip. But for the longest time, insurance companies weren't paying for the prevention. Now, fortunately, that is changing now. Fortunately, they're doing a big awareness campaign. So the American Physical Therapy Association, as well as my franchise, the Physical Therapy and Balance Center, we do a ton of marketing campaigns now trying to be proactive about this. So we have what's called our Fight the Fall campaign. So every fall we are going out and we're doing fall screening, testing people's balance, saying, hey, did you know this is a problem? Looking at some of the biggest different risk factors for falling or for losing your balance. But to answer your question, yes, absolutely. Most of these people had signs for years before, and either they didn't take it too seriously or the system didn't take it seriously enough for them. And then they ended up having a major issue.
Okay, so I could just come into you and see and and you could give me a test and see if I'm on that balance. What would you call it? I don't
Fall risk.
Fall risk.
I
That's
would
it.
say you're a high fall risk. So I could do you a couple better. So yes, you could do it in my office. We could also do at-home screenings. There's a couple of simple tests that you can do at home and a couple of simple surveys here. Let me actually.
I bet you I'm a fall risk.
You think so?
You got a problem with risk?
I think I am. Yeah, I would think I am.
Okay. So would it be useful to go through like a
let's do
12
that.
question yes no?
Want to do this?
I want to hear what you answer. So yes.
All right, I'm kind of scared.
You need to score a 5 or more
Okay.
to be a fall risk.
Okay.
So the scale is 1 through 10 or 1 through 5 or?
So it's a 3, 6, 9, 12 question questionnaire.
Okay.
The first 2 questions are worth 2 points. The rest are worth 1 point.
Okay.
So, okay, gotcha. I understand. So you score a 1 or a 2? You'll explain.
It'll depend on the answer, which question. Okay. So it's like a yes or no. So 5 to 8 is kind of your like fall risk window. Anything over 8, like I'm coming to your house tomorrow and we're doing therapy.
Oh,
okay.
I'm just kidding.
Okay.
All right. So question 1, I have fallen in the past year.
Yes, I have.
Yes. Question 2, I use or have been advised to use a cane or a walker.
No, that's
no. Okay. Question 3, I sometimes lose my balance when walking.
True.
True. Question 4, I worry about falling.
True.
True. Okay, you're sitting at a 4. Strong start.
I'm just gonna get nervous now.
Question 5, I use my arms to push myself up from a chair.
I think I do.
You think you do? Okay.
Yeah, I do.
Yeah. I sometimes have trouble stepping up onto a curb.
Sometimes. Not often, but sometimes.
Okay. My body sways when I'm standing still.
Oh, that I don't know.
Not on purpose.
I don't know. Can I say no? I'll just say no.
You could say no.
Okay.
I take short, narrow steps.
Yeah, I do.
Okay. I stumble often or look at the ground when I walk.
Yes, I do. Oh no.
Okay. This one's a
coming to your house.
This one's a bit of a curveball. I frequently have to rush to the toilet. We can edit this one out if you don't want to answer that.
Oh my God, yes, I do.
And I have lost some feeling in one or both of my feet.
No, that I don't have.
Okay. I take medication that makes me feel lightheaded or sleepy.
No.
No. Okay. So I think I was keeping score on my fingers here because I didn't have a pen handy. I think I counted 6.
Okay, so I'm
your threshold.
okay.
I'm a 0.
So that's a good test for your 0. Good job. Good job.
Of course she is. We're opposite.
I like this test. So I like the questionnaire because it's very like whoever's listening they can take an assessment themselves and they can see, okay, where do I stand and do I need to reach out to you? Because clearly these are all really good, simple questions. It's not like, anyway, go ahead.
So here's my next question for you. Is this a myth? I'm mostly deaf in my right ear.
Okay.
So I always say that's why I maybe don't have good balance because of my hearing. Is that a myth?
Ooh, that's a loaded question.
Oh.
Yes and no. Do hearing problems cause a balance deficit? If you've ever worked with a physical therapist, I'm going to give you the most physical therapy answer ever. It depends. Typically, no. But there are a lot of conditions that can affect both hearing and balance. Okay. So the question is, if you were a patient, I would be saying, why is the hearing lost? Is that from, I went to too many concerts when I was younger? Is that I have Meniere's disease? Anything in between? Is there an underlying condition? Is there something that's contributing to the hearing loss? Now, without knowing anything about your medical history,
right.
And not even knowing your age and knowing well enough to not even guess somebody's age, I would say more likely than not, I would guess that you had at some point in your history a viral infection in your inner ear that caused a degree of hearing loss, maybe some ringing in the ear, maybe some buzzing in the ear. That's the second most common cause of vertigo in general. It's something called vestibular neuritis or vestibular labyrinthitis. There's a technical difference between the two, but for all intents and purposes, it's the same thing. But I would just kind of speculating. Sorry, I'm trying not to armchair diagnose you from via Zoom.
Just being like what everybody says is like, oh, it's if you don't hear right out of one ear, then it's going to affect that. And maybe it's more. It definitely
can. A lot of balance conditions are related to inner ear dysfunction, and a lot of those conditions can cause hearing loss.
Okay.
But just going back is not going to make you lose balance.
Okay.
I think maybe this is my naivete, but I would think that if you can't hear and then you like tilt your head or you lean your body, that would cause you to be off balance.
Absolutely.
Okay.
That could. One of the exercises that we do a lot of in vestibular therapy or balance therapy, we make people stand while moving their head in certain ways. So for example, we'll say, okay, close your eyes and tilt your head side to side. And you'd be shocked how the head position can contribute to losing your balance. I won't bore you with the details of all the inner ear structures and the semicircular canals and all this fun vestibular anatomy, but all of that gets manipulated as the head position changes. So any unusual posture is going to cause a balance disorder.
So posture has a big role in balance then.
Yes and no. Yes and no. So like in this particular case where we're talking about like the side to side, absolutely. Now bad posture, it's not going to really throw you off too much, but it can make your hamstrings weak. Having bad posture can make your hamstrings weak, or vice versa, depending on your perspective. Having weak hamstrings can make you have bad posture. And then that being a little bit less strong is going to predispose you to a little bit being a little bit more off balance or not being able to catch yourself as much.
Wow.
So I was reading on some medical website that if you can balance on your leg for 10 seconds,
One leg?
on one leg, that it improves the odds of a longer lifespan. Is that true? And can you talk about that?
I 100% agree with that.
Really?
Oh yeah.
Okay, go ahead.
So I have no research to back that up, but that makes perfect sense to me.
There was some study done, so yeah.
Okay. Oh, and I believe it. I believe it. So the first thing you need to understand is I take my job a little bit overly seriously sometimes because balance, I don't know where the stats are these days, but is one of the top 10 leading causes of death in this country. And about 3 or 4 of the other leading causes of death are directly related to falls and fall related complications. So for example, I've been fortunate enough to work across the spectrum of people's lifespans. I've worked in the acute hospital, I've worked in skilled nursing facilities, I've worked in hospice.
Oh.
The unfortunate reason for a lot of people passing is a little bit, it's never a pretty picture for a lot of people. But what I see happen to so many people is they're in their 80s, they fall, they break their hip, they can't walk because they break their hip. They stay in bed for a month or two. They get pneumonia or a bed sore. They get sepsis, and the sepsis is what kills them.
Mm-hmm.
All of that, if you walk it back, all of that is directly related to the original fall. So going back to your point about standing on one leg is arguably the best 10-second test for balance there is. What I tell people is if you want to be able to walk without a cane or walk without a walker or not having to grab onto something when you're walking, you need to be able to maintain your balance on one foot. If you break down walking in slow motion, every single time you take a step, every single time you're lifting your foot up, you're essentially standing on one foot. So as we're walking, if you don't have that ability to maintain that single leg stance balance, you will inevitably start taking shorter steps. You will struggle on curbs. You will struggle on stairs because your body's not able to maintain a one-legged balance hold for 1 to 2 seconds or even less, let alone 10 seconds. So if you can improve that one-legged balance, that's an exercise I give people all the time. Like if you knew absolutely nothing about balance, just practicing standing on one leg would be like the number one thing I would recommend for people of all ages, provided that it's safe.
Are there certain medical conditions that you see that indicate or that are causing balance issues?
So the number one is vestibular disorders, inner ear dysfunction. I think it's like a 16-fold increase of falling, if I remember right, if you have an inner ear disorder. The other one that's very common for people is neuropathy. So particularly for the diabetics, when you have that neuropathy in your feet and you lose that sensation in your feet, that would be the number 2 biggest predictor of a fall or a fall-related injury. Okay. Reason being is your brain needs to rely on your eyes, your inner ear, and the skin on your feet feeling the world underneath you in order to maintain our sense of equilibrium and balance. And when you get that neuropathy where your foot is numb, it's just like when you go to the dentist and your face gets all novocained up and you can't swallow right. If that happens to your feet all the time, people have a hard time navigating the world, especially if the surface is changing, if they're going from carpet to hardwood to grass to curbs, or if it's uneven, because they can't feel as well with their foot, their body can't adapt as well. And that, I would say, is one of the largest reasons for falls that I see, one of the most common.
And that's really, there's not much you can do about that, right?
Unfortunately, no. The neuropathy, there's not much you can do to fix the underlying cause. Are there treatments available? Yes. Are there people that will try to sell you really expensive supplements that can fix it? Yes. If somebody figures out a way to reverse neuropathy, they're going to get a Nobel Prize. If there was a treatment for it, it would exist. I don't care if it's your neurologist pushing gabapentin that's not going to work, or, I've seen a lot of different alternative health supplements and techniques and treatments out there. Boy, boy, if you guys figure it out, let me know. But I've seen a lot of people, particularly the neuropathy, I'm a little passionate about, because I've had a lot of patients that have been swindled out of thousands of dollars over the years, where they go, oh, hey, try this magnetic something or another. It's going to reverse your neuropathy in 8 weeks and it costs $5,000, and the insurance companies don't want you to know about it. There's a lot of those people out there that kind of breaks my heart when you have grandma that's on a fixed income and she's shelling out money left, right, and center because insurance won't cover it. And it's this, oh, it's big. They always say it's big in Europe. That's kind of your key. Insurance doesn't cover it, but it's big in Europe.
So maybe this is
I really hope I'm not stepping
no, it's
toes.
fine. If and maybe I don't understand the medical system, like the situation very well, but if you have neuropathy that's directly related to diabetes, if you take care of the diabetes, does that help the neuropathy or no?
Absolutely. Absolutely. The question is always when, where, and for how long. So say, for example, somebody is pre-diabetic and they're starting to get early signs of neuropathy. If they were to get to a point, and I'm hoping this is something that you guys are working on with your clients, where if they're getting to that point where they have that, come to Jesus moment and they're radically changing their diet, they're radically changing they're monitoring their blood sugar, they're doing everything that you would hope. They start dieting, they start exercising. I don't claim to be a nutrition expert, but I know there's a lot of literature on more ketogenic stuff. If they can stop it in its tracks, there can be some reduction in symptoms in the short term. Now, what's not going to happen is somebody that's had an A1C of 15 for 20 years that hasn't felt their foot in 10 years. You can eat all the carrots and everything you want. You're not going to change that. So it's always where are you getting on the spectrum? If you're in that early stage, which I'm hoping is where we can do the most impact as we're trying to be more, public health educators and trying to get out there. The goal is on the prevention side of things. Nerve damage is nerve damage, no matter how you slice it. Once you get permanent nerve damage, I wish I could tell you there's some hope there, but no one's figured out how to reverse nerve damage as of yet. And like I said, if they figure it out, it's going to be a Nobel Prize, and we're going to hear about it on the news. You're not going to hear about it on the back of a magazine.
At the grocery store checkout on a magazine. They're not.
Yeah.
So where you come in for those type of health problems is like you're working with what they already have. And okay, let's try and improve your balance with neuropathy and you, right? Am I right on that?
Yes. So what I tell people is, you have your 3 pillars of balance. You have sensation, vision, and vestibular. So if we know sensation is shot, what we have to do is we have to start training your body to rely more on the vestibular system and on the visual system. So what we'll do is we'll do exercises that force you to rely on that. So like an obvious one would be standing with your eyes closed, or standing on like a silly, blue foam cushion that every physical therapy clinic has. And you're standing on the foam with your eyes closed and you're turning your head. Well, because my eyes are closed, I can't rely on my visual system. And because my feet are numb, I can't rely on my sensation. So by definition, I'm relying on my vestibular system to not fall. So by using this process of elimination and canceling things out, we can strengthen the vestibular system to be more robust and more reactive.
What? Okay, go on, Kamna. Because I've stood on a pillow before without my eyes closed and I get wobbly.
Yes.
So does that mean I need to work on my vestibular and my visual?
Possibly.
What is your opinion of the Bosu balls that are in the gyms where you stand on them for balance?
I like a Bosu ball. I definitely have them. I definitely use them. I find they're a little bit better for your more younger balance patients.
Okay.
That would be more your 40s to 60s. Or even younger if there's some underlying medical condition. For your patient that's maybe 60, 70, 80 on a walker already, the Bosu I find is generally too challenging, and it's a little bit more risky. It's always a fine line with balance. If you want to improve your balance, you have to challenge your balance, but we have to be safe about it. So if you're not challenging, one of my lines that I tell my patient is, if you don't feel like you could fall when you're doing this exercise, we're not making it hard enough. Just like if I'm lifting weights, if I'm bench pressing, I go, oh, this weight is so light, I feel so strong. I'm not really going to make good strength gains. So if you want to make good balance gains, you have to have that similar feeling. You have to have a little bit of that hesitation of like, oh, this is tough. Like I can do this. It's like, standing with your feet together, like what I call the DUI position, the tandem stance. If you do that, most people are like, okay, I can catch myself. I'm not going to end up on my face, but this is hard. So you always have to have a little bit of that difficulty, a little bit of that challenge. I'm always looking for the Goldilocks zone. What is challenging enough that it's going going to be able to be effective, but easy enough that the patient can do it without hurting themselves. So to the Bosu question, I go, oh, you're going to hurt yourself. It's a great piece of equipment. I have like 2 of them, but a lot of the people that are thinking about this, that's probably too much for them.
Okay.
Okay. Yeah. When you were describing, I know it's not the same idea, but when you were describing it, it reminded me of a trend maybe late last year where people would mark off a square on the floor with some tape, and then they would close their eyes and march for, I don't know how long, a minute. And then they would see where they would end up, and they were always out of the square. Is that
That's interesting?
I remember that trend.
Okay, so I am like
no, but does that indicator of anything, or is that just normal human steadiness?
So what I'm thinking is when you say that, I go, oh, that's something called the Fukuda March test. So what I would do in the clinic is I would essentially have like picture a protractor with all your angles on it. What we would do in the clinic to find a vestibular disorder would be, okay, start in this center point and you're going to march for 30 seconds. So if you move forward or backwards and you would come out of that box, that would be totally normal. Everybody does that. What if you fall over? Okay, well, that's obviously a problem. Or if you're stumbling or grabbing a hold of things, okay, obviously that's just a generalized balance problem. What I would do in the clinical sense is I'm looking at the rotation. So if they have, like, I literally just did this test like 2 hours ago on a patient, and with their eyes closed, they start facing me and they end up at a 90-degree angle this way. And then it's always a fun moment where I say, okay, open your eyes. And I go, what? I had no idea. So that's usually a sign of several different inner ear disorders.
I'm going to
But
totally.
it's just funny to me that that's become a meme.
I'm totally doing
It was
this
a
later.
trend, and I was like, "This
Yeah.
is so interesting." And I think I wouldn't get out of the box. I would be totally fine. But clearly, that's
It's hard
Gotta
to
do
do.
it.
It's hard to do.
yeah, it's hard to do. Everybody's out of the box, so I'm just curious if that has any correlation to balance. I had a question about vertigo. Actually, I have a lot of
Ooh.
questions, but
Oh yeah. Good.
can we talk about if someone's newly diagnosed or they're diagnosed with vertigo? Is this something that you can help them with?
Oh, you're just setting me up perfect. I love this. Absolutely. Absolutely.
Oh, good.
So, all right, I'm gonna try not to get on my soapbox too much. So,
Okay.
vertigo is a terrible diagnosis. I hate when primary doctors or emergency rooms diagnose somebody with vertigo.
It
Vertigo.
means I don't have an answer for you, right?
Really?
Correct.
Okay.
So, vertigo is a symptom. Just like if I come to you and I go, hey, I have pain in my stomach, and you go, me with my medical doctor, I'm going to diagnose you with pain. It's like, no, that there are thousands of things that cause pain in the stomach. I need to know if my gallbladder needs to come out or if I just have heartburn. So much the same way, vertigo, it's just like that. Vertigo is a symptom.
Okay.
Now, most of the time when people in the medical community use the word vertigo, they're referring to one specific type of vertigo, and there are thousands of things that can cause vertigo. Most of the time when people get diagnosed with vertigo, they're referring to something called benign paroxysmal positional vertigo, also known as BPPV for short, or more colloquially, people will refer to it as having crystals loose in your ear. The crystal problem. Is this ringing?
Yes. Go on.
So the crystal problem, or the BPPV, that's the most common type of vertigo, but it is far from the only type.
Okay.
Now, I have noticed in our area in particular, a lot of physicians, because they're so rushed for time, they don't actually test for vertigo. You want to know how you test for benign paroxysmal positional vertigo? Easy to do at home. You turn your head to the left, you lay down. If that brings on your symptoms and you feel like you're going around a merry-go-round or a roller coaster, boom, you have vertigo. Try the left side. If the left's fine, you do the right side. In a perfect world, your head would be off the edge of a table or off the edge of your bed. If that doesn't work, you would want to kind of have like a pillow here with your head kind of off the back of the pillow. You would lay back like that. If that is like, whoa, my eyes are jumping and I feel like I'm at Cedar Point right now. Okay, congratulations. You have BPPV, the benign paroxysmal positional vertigo. That's my bread and butter as a vestibular physical therapist. I saw 3 people with it today. The way you treat it is by doing what's called a repositioning maneuver. So you essentially move the head a few different ways, and it'll help get these loose crystals back to a part of the ear where they can be dissolved by the body. And then when done properly, symptoms are gone in like 1 to 3 sessions. So I always tell people 3, and then they call me when they cancel their second appointment because they're 100% better.
Okay, so
One to three sessions?
Are they really crystals?
Are they really crystals? Great question. So the technical name, we've called them crystals for short. The technical name is otoconia, oto meaning ear, conia, I forget my Latin, means something. I should probably know that. We can edit that
It's
part out.
okay.
I don't care, you can leave it in. But essentially what it is are these little calcium carbonate crystals. So what happens is you have part of your inner ear, something called the semicircular canal. Essentially, You have 3 different canals in each ear. Picture a cave, and in your cave, you have your stalactites and your stalagmites, right?
Right.
So you have one on the top, one on the bottom. I'm not sure which ones are which, stalactites or stalagmites. But in the inner ear, what happens is every now and again, for whatever reason, and there's a few different causes, one of those little cave stalactite things will break off. And that's what becomes the crystals. So everybody always thinks like, do I have these crystals born with me, or did they grow? Where did these come from? No, it's a natural part of your inner ear. It's just like scaffolding that's holding up your ear. And then just for whatever reason, that scaffolding breaks and now it's loose and it's causing a problem. And we as therapists or doctors or ENTs or neurologists, a lot of different professions will try to treat this. We're trained to read how these crystals move through the ear, and there's a reflex between the ear and the eyes. So what we're taught is when we turn the head certain ways, if there's a crystal in a certain part of the ear, it'll cause an intense nystagmus or eye movement. It's what cops look for when you're look at when you're doing like a DUI screen, where the eyes will do just this rapid motion for anywhere from 10 to 30 seconds, and then it'll slow down and it'll stop. And the patient will feel like they're spinning that whole time, and then it'll slowly come to a stop. And then that's how we're trained as to where the vertigo is. And then there's a whole other sequence of like, okay, how do I move the head to make this go away?
Has anybody ever thrown up?
Yeah, it happens sometimes. We have vomit bags.
I was gonna say,
Oh.
when you said like this, I just imagine I think I would throw up, but
Yeah, it's not as bad as you would think. Like people definitely do throw up, but it's not as often. Maybe like one a month, and I do probably 2 or 3 of these a day.
okay.
So it does happen, but it's it's always fun when it does. So
I had no idea. Okay, so and then it just gets dissolved with the body, just dissolves that little crystal thing.
yes, your body will dissolve it.
So if somebody wanted to work on balance at home, are there things you recommend?
Yes. So, certainly I'm one to always encourage a customized program. If somebody comes to me as a clinician, I'm going to say, okay, what are, we're going to test everything. We're going to test your inner ear. We're going to test your eyes. We're going to test your strength. We're going to test your back, yada, yada, yada. And then we're going to build a custom plan for it. That's always what's best. I can give you a few just kind of general principles. Now I'm curious for just from my perspective, what's kind of your typical audience look like? It's like kind of like generally more like 40s to 60s. Is that right?
I think we're a little bit skewing a little bit older.
Skewing a little bit older. Okay.
Yeah.
So I'm going to give some general advice. I would say the older somebody is, the more cautious I would recommend them being. I
Okay.
have patients that are 95 that can do stuff that my 40-year-olds can't do, and vice versa. So everything is always context dependent. Everything is always, you always want safety first. So a few exercises I would recommend is, one, even if you don't have neuropathy, eyes closed, head motion exercises. One of the first things I give my patients. So you're standing up, you close your eyes, you just do a little left and right. And you just go nice and slow. Maybe you need to hold on to the back of a chair. Maybe you need to hold on to a walker. Depending on how old you are, that may be very easy or that may be very challenging. If I have a 72-year-old with neuropathy that's on a walker, they may fall over doing that. If I have a 40-year-old athlete, they're going to just laugh at me and go, that's stupid. I don't feel anything. That's easy.
So if you do that, and do you feel dizzy when you do that?
You can. If you do, that's a sign of an inner ear problem.
Oh my God. That happens. Okay. This is the truth. Sometimes
Okay.
I'm not going to do it ever again. Let me just say right now, for the record, I'm never doing this again. But sometimes I have taken a shower with the lights off and like tried to like relax.
Okay.
And just the darkness, or if I close my eyes, I feel like I'm gonna throw up, and then I have to turn the light on. So that's probably a dizziness problem, right?
So I have a running joke that I'll do what I call my shampoo commercial exercise,
Okay.
which is basically what we were just doing with the eyes closed, but it's more that like this kind of thing.
Yeah.
But particularly eyes closed, because nobody wants to get water or shampoo in their eyes. Eyes closed, head back is one of the most challenging positions on the vestibular system for a lot of different reasons. And that can trigger a lot of dizziness in people for a lot of different reasons.
Wow.
Oh my God. I need to come see. It's very clear.
So
You're fine. You're fine.
I have so appreciated talking to you. I think, like I said, I think all really relevant, important information, and you're so knowledgeable. Clearly,
Yes.
you know
thank
your
you.
stuff.
And you explain it in a way that I understand, because I'm always
Mm.
like, dumb this down for me, and you did that exactly what I needed.
Yes.
Perfect.
Thank
Well,
you.
I hope this was helpful.
Thank you so much.
You're welcome. Thank you for having me on.
Yeah.